Hi viewers, it's me again. I'm actually coming to you about 18 months post-surgery, but the reason for this video is that I have had several viewers reach out to me through email and comments asking me some questions that made me reflect on the fact that maybe I've not adequately covered the symptoms of prolapse, specifically related to what I had. I know I've talked a lot about my journey, kind of how I got there, and a ton about my recovery, but in reflecting on it, maybe I haven't been real specific about how I knew I had a prolapse or what that felt like. So I wanted to create a video to explain that. If you've watched any of my other videos, you know that I discovered my prolapse when I was about 3 months postpartum. So there were obviously still some lingering things going on down there that made it a little bit difficult to decipher exactly what I was dealing with. But I would say that one of the first things I noticed was that, you know, I had the baby, I had a little bit of pain, but for the most part, it didn't really feel like much. But a couple months into my postpartum period, I started noticing a lot of heaviness down there. I would describe it as kind of how it feels at the end of a pregnancy when you just have a lot of pressure down there. It just feels like heavy and kind of a dull aching. So that was kind of the first thing I noticed. The second thing that I would not have thought was related, but come to find out actually was, is I was having a lot of hip pain and a lot of lower back pain, like pain in my low back, down by my tailbone, just very low back pain, some back pain kind of shooting into my butt cheeks, as well as, like I said, just hip pain. I was having a hard time sleeping at night because I was having, felt like pressure hip pain, like laying on my sides, but also kind of some shooting pain through my hips as well. So again, I would not have contributed that to a prolapse at all, but I found out when I visited my surgeon that actually one of the primary symptoms of a prolapse is that, because all of those nerves down in that pelvic floor connect to those same nerves that are in your hips, are in your butt, are in your low back. It's kind of crazy how it all connects. I've learned so much about that in this recovery journey. The other thing that's a pretty telltale sign was, although I was new to getting back to sexual activity and expected things to be a little different, it was baby number 3 for me though, so I had been through this 2 other times, and it was just different. It felt like there was a lot of friction. It felt like almost like there was a blockage, and I would say, that's because there was. So it just didn't feel the same. My husband couldn't get the same level of penetration that he would have before. I had a lot of discomfort. I wouldn't even necessarily call it pain, but just like, this is not comfortable. It felt like no matter how much moisture we attempted to use, it didn't make a difference in the friction. And looking back on it now, that's because, well, honestly, he really had nowhere to go in there. As a review, I had cystocele, which is bladder prolapse. I had rectocele, which is rectal prolapse, interocele, uterine prolapse, and I also had vaginal vault prolapse. So my vagina, rather than being stretched out like it should be, had just collapsed. So that had to be fixed surgically. So prolapses come in levels 1, 2, 3, and 4, starting with level 1 being very mild, level 4 being that the prolapsed organ is actually prolapsed out of the vaginal opening. So mine all ended up being level 3 prolapses. So nothing was actually hanging out of me, but it was all right there at the surface of that vaginal opening. So when I started to question what was going on with me, the first thing I did was I kind of did a self-physical exam and got out a mirror and just sort of looked down there, and I immediately noticed that there was something at the opening of my vagina that had never been there before. And I've said in other videos that I was very uninformed about what this was. No one in all of my pregnancy journey or my deliveries had ever talked about prolapse with me. So I literally got out my phone like, handy Mr. Google, what is this ball of tissue in my vagina? And the first thing that pops up is prolapse. And as I read more about prolapse, specifically cystocele bladder prolapse, that is what I thought that I had going on. But if you have a pretty significant prolapse, level 3 or more, you're likely going to be able to see it with a mirror from a standing position. Not so much laying down, but standing. Gravity is going to pull all of those organs down there, and you should be able to see it at the opening of your vagina or just slightly up in there. If you have a really bad prolapse, like level 4, you might actually have stuff coming out. Another symptom I was having was trouble having bowel movements. I could have them, I could feel them, but not much was happening. Like I would go sit on the toilet, I would go a little bit, but I would never feel like I got full relief. And that's very common. I've met many women who've been through this, who in order to have a bowel movement before having their prolapses fixed, actually have to either use a pessary or use their fingers to push their organs up in there out of the way in order for the bowel movement to come through. So if you are at that point, I highly encourage you to consult a good surgeon. You should not have to live like that. That's not okay. Not okay for your mental health, for your physical health, anything like that. I was definitely having some urinary issues. I was obviously having the urinary incontinence related to stress incontinence. I've talked a lot about that, where I would like urinate on myself when I coughed, sneezed, jumped, anything like that. Any unexpected downward pressure would cause me to have stress incontinence and urinate, leak all over myself. But toward the end of my prolapse, before they got fixed, I was also having issues fully emptying my bladder. It was described to me that my urethra, instead of being like this, like it should be, was kinked. You know, my finger won't bend in those directions, but it was kinked. So it was having a problem even flowing past here, but then also my bladder was compressed because it was not in the right location. So I would feel like I had to go all the time. I'd go to the toilet. It would feel like I should have a very relieving urination, and I just never felt like I could fully empty my bowels or my bladder. So when I went in to have my various procedures done, when they would try to catheterize me, they always had a very hard time getting a catheter in. I have that in another video talking about, it's my how to find a surgeon video, talking about a very painful catheterization experience. But it's very difficult to get a catheter into your urethra when it is kinked, right? So a trained nurse who does this every day will be able to go at it at a different angle, or know that when they hit a kink, they either need to push down or push up depending on the direction they think that the kink is. But those are some symptoms I had. So again, to recap, pressure down there. Felt like I was due to have a baby any day. Started having issues with fully emptying my bowels and emptying my bladder. I had hip and back pain that ranged from dull to shooting sharp pain. I had friction with sex. Just didn't feel right. Just didn't feel like we had the same range of motion, no matter how much lubrication was used. And then took a look and noticed it. So like I said, that's kind of the final test. I think you'll be able to see it if you're looking from a standing up position with a mirror. So those are my symptoms that I experienced. Obviously it could be different for another woman, but I think most of those are pretty common, especially if you have some pretty significant prolapses or you have some similar ones to what I had. So I would suggest, if you're experiencing any of this, you should definitely go see a doctor. You can start with your gynecologist and then see who they recommend you go to. But as I said in my how to choose a surgeon video, I don't recommend this type of repair work be done by a urologist. Like, certainly a urogynecologist, but even better, a vaginal surgeon is who should be taking care of this situation for you. So please do your research when you go to find somebody to perform these types of treatments on you, because it really can make or break the prognosis of your recovery. And I would hate for anyone to have repairs done that ultimately cause further damage or need to be corrected in the future. So as I always say, I am not benefiting off of this channel whatsoever, but by you subscribing to the channel, you are helping drive I don't know, viewers' attention to the channel, it helps them find it. The analytics are more likely to show my channel the more people who've subscribed or visited or watched the videos. So please help by doing that. Feel free to, you can give me a comment, or even better is there is an email address. It's personalprolapsestory@gmail.com if you have any more specific questions or something you don't feel okay commenting public. So I would be happy to answer those for you. I've really enjoyed making contact with some of the women who are benefiting from my channel, and I'm truly happy to interact with anyone who reaches out. So thank you. Have a good day.